Hello, my name is Nire. I did my assignment on Medication Administration Safety Improvement Plan. The purpose and goals of this in-services session is that nurses will be understand the significance of medication administration error and patient safety. Staff will implement an evidence-based strategy shown on the reduced medication error by 54% according to BAS 2022. Nurses will be demonstrated competency in high alert medication verification protocol through stimulation exercise. Staff will be follow the specific 4 phases implementation timeline spanning 9 months total. Everyone will be participating in continuously improvement through structural feedback medication safety. The nurses will also understand that significant medication administration error in patient safety. Staff will implement evidence-based strategy showing a reduced medication error by 54%. Currently, medication safety challenge. Interruption during medication preparation increased error risks of by 12.7% per interruption, hand and BAS on 2022. The high alert medication protocol are interestingly followed during administration on medication surgical units. Communication breakdown regarding medication regime occurs frequently during shift handoff, according to hand on 2024. Nurses fatigue after consecutively 12-hour shift increased error rate by 30%, Vigilant 2023. An alert fatigue medication, the cause critical awareness system to be ignored during medication administration. Evidence-based safety improvement plan. Distraction-free zone will establish protected environments, reduce error by 12.7%, hands on 2022. The barcode medication verification system will be reduced administration error by 54%, gallery at 2023. The standard communication tool will improve medication information transfer and continuity. Workload adjustment will address consecutively shift limitation identified by Vagro 2023. Staff education will be focused on specifically on high alert medication administration best practice. Phase 1, implementation distraction free zone. Physical screening for medication preparation areas will be reduced environmental interruption factory effectively. Medication administration vest will virtually indicate where nurses should not be interrupted. Medication in progress signet will be deter non-urgent communication as recommended by safety literature. Dedicated staff will be manage non-urgent matters during peak medication administration time daily. Staff will be practiced using visually cue that have reduces interruption by 87% and hand and wash on 2022. This phase will be fully implemented within 3 months with weekly staff feedback. Phase 2, implementation technology and protocol. The Burkhardt medication administration system will be received urgently and shown by reduced error in gallery 2023. High alert medication protocol will be required mandatory independently double check verification before administration. High alert medication protocol will be required mandatory independent double check and verification administration code. Insulin administration will be required second nurse verification before proceeding prevent doses error. Implementation will be complete within 6 months with monthly effectively monitoring process. Phase 3 Implementation Communication Protocol 2024. The monthly stimulation season will be practice interprofessional medication communication skill with measured outcome. Medication reconciliation protocol will be standardized patient transition procedure as demonstration by Al-Jamid et al. 2023. Communication checklist will be ensure consistent quality of medication administration during shift change. Implementation will be occur currently between months 4 and 9 will be bi-weekly assessment. Phase 4 Implementation Workload Management. Nurses' schedule will be limited consecutively 12-hour shifts as recommended by Regulist 2023. Patient assignment will be adhered to evidence-based nurses patient ratio standard for the safe care. And additionally, staff will be assessed during high volume medication administration time to reduce error. Quarterly medication safety education will focus on error prevention strategy with competency validation. Continuous assessment of implementation effectively will guide ongoing adjustment throughout the process. Your role implementation success. Every nurse must be strictly adhere to the 9 protocol demonstration in order in today's training session. Staff will be actively participated in monthly education and simulation session for skill development. You will be regularly provided feedback regarding implementation process through the anonymous electronic services. Each person will help identify potential risk requirement intervention using the new reporting system. Everyone must demonstrate accountability for medication administration safety and practice during every shift. Why your role is matter. Patient safety directly depends on your consistent protocol adherence during every medication administration. Each nurse serves as the final safety check barrier prevented patient harm event. Your feedback will be continuously improve the quality of the implementation process monthly. Your first-hand observation provided critical insight for process infrequent and protocol adjustment. Together, we build sustained culture of medication safety that improve patient's outcome. Skill practice activity. Pair will be practice distraction-free medication preparation during the stimulation scenario of framework. A couple will be role-play effective medication focus handoff communication technique emphasized by Han L 2024. Team will be demonstrated proper high alert medication double check verification procedure with competency validation. Everyone will be practiced, responded appropriately to critical safety alert and simulation scenario. Staff will be provided initially feedback to propose protocol effectiveness using standardized evaluation form. Feedback and continued improvement. Anonymously electronically survey will be gathered weekly implementation process feedback from all the shift. Monthly unit meeting will be discussed challenging requirement immediate attention based data analysis. Quarterly data analysis will be tracked medication error rate change as recommended by safety literature. The implementation team will be review all staff suggestions with response within under 72 hours. Success will be measured through multiple patient safety metrics, including reduced adverse effect. Thank you, and if you have any question, implementation will be texted with electronic zone of preparation on the institutional box. Education session will be continued throughout the implementation time process with competency validation. Requirement material including evidence-based practice and all valued will be implementation are available to address specific concern via email or unit visit. Your commitment to patient safety service or success, reduce medication administration error. Question or concern may be addressed now or anytime throughout implementation process. Thank you for your attention.